Homelessness in America is an urgent public health issue. The U.S. Interagency Council on Homelessness states that more than half of Americans live paycheck to paycheck, just one crisis away from losing the roof over their heads. But that doesn't mean that they'll all end up on the street. In fact, those living on the street make up only about a third of the homeless nationwide. Far more sleep in shelters or in their cars, and less than 20% are chronically homeless. The rest have fallen over the edge of poverty for just a few days or weeks.
There is no real single predictor of what separates a very, very poor person or family from being housed or homeless. It's just there are no easy predictors of that. It just seems to be some crisis of economic proportions.
That's Dr. Deborah Padgett, professor of social work and global public health at the Silver School of Social Work at New York University.
For any given person, it's often a matter of a life of poverty, sometimes of trauma, and then a medical crisis or an eviction based on landlords upgrading the properties, raising the rents exorbitantly. Those kinds of things happen at the downstream or sort of the proximal level. But the ultimate cause of homelessness is the fact that since the Reagan era, and starting somewhat before that, the federal government has stopped building new public housing and really ratcheted back support for rental vouchers and that kind of thing. And for the most part, left it to the private sector to build housing with some kind of hope or wish that some proportion of that would be affordable, which, of course, for the private sector would cut into profits, so makes it very difficult.
Nearly half of Americans don't have enough savings to pay an unexpected bill of just $400. So the homeless could be anyone.
The typical, if you say average homeless situation, is a single parent, usually a mother with young children. And again, you get disproportionate numbers of African American young mothers and young children. But what we're seeing also with families is a growing crisis of older single adults or older adults with adult children who are homeless, living together with their adult children in cars. And then among youth, the average homeless youth is someone who's either aged out of foster care or is a runaway or a push away, shall we say, from a dysfunctional family situation.
Most people are unaware of that, Padgett says, and instead accept as fact many of the myths and misconceptions about the homeless. Sadly, this misinformation often makes the conclusion that if you're homeless, it must be your own fault.
To blame the victim is sort of to shine the spotlight away from the larger picture of what's going on here. But it is very much human nature to see a person and say, here you are on the street, you've made bad decisions, you're using drugs, or you had a health crisis you couldn't work around, or, these kinds of things.
Padgett says one of the biggest myths is that most homeless people are mentally ill, turned out onto the streets by deinstitutionalization. However, Padgett says that the proportion of mentally ill homeless people isn't that big, nor does deinstitutionalization fit into the timeline of when homelessness exploded.
Given the persons who were severely psychotic on the street were so visible and got so much of the public attention, there was this natural tendency to say, well, we closed the hospitals, therefore most homeless people are those patients who were released from hospitals and had nowhere to go. But the problem with that is that deinstitutionalization really started in the 1960s and 70s. So there isn't a timeline that really does that fit.
Another myth, that most homeless people are alcoholics or drug abusers who spend whatever money they get on their habit. Padgett says experts believe that 20 to 40% of the homeless have a substance abuse issue. That's still a serious number, but she says it's rarely the sole cause of homelessness. More often, it's a response to being homeless.
We don't want to pretend that they don't spend money on drugs or alcohol, but so do the rest of us in our homes. So does the rest of American society spend. And to a large extent, that spending is often a way of kind of escaping the realities and the horrors of living on the street. So that's kind of the approach that we take, is that some people do spend their money. But when we really talk to them about how they make a living and what little money they can make through recycling cans and so forth, most of that goes to buying food or toiletries and necessities.
Homeless people are also often seen as criminals who are prone to violence. Padgett says in reality, violent acts are often in self-defense. What's more, the homeless are more likely to be victims of a crime than perpetrators. However, it's true that homeless people are more likely to have criminal justice intervention, but that's because homelessness itself has been criminalized.
It's been criminalized from the very beginning, but it seems to be getting worse as public sympathy to help the homeless or to punish them tends to rise and fall. But local business districts and usually political authorities see no upside to it and prefer to have the police or some ways to punish the homeless. And so the criminalization is largely small ordinance violations like trespassing, public urination, but whatever they're doing are just doing the things that the rest of us do indoors but don't get punished for. And the criminalization comes from getting a summons to appear in court. You don't appear in court, then a fine goes out, and before you know it, you're in jail for not paying the fine for that small infraction. And so many homeless people get caught up in the system and end up spending some time in jail strictly for doing things that, like I said, the rest of us do indoors and don't get punished.
Many people believe that the whole problem wouldn't exist if the homeless had enough responsibility to go out and get a job. But what you may not know is that many homeless people already do have jobs, but they don't pay enough.
A significant proportion of homeless people do have jobs. These are often people who sleep in their cars because they simply cannot afford to pay the rent on the salary that they're making. The ones we interview, the homeless people, are more likely to be chronically homeless and to have mental problems and so forth. But even those individuals have what we call kind of income-creating activities, whether it's recycling cans, passing out flyers for a local business. Sometimes it's sort of underground economy. It could be selling drugs or contraband type things. But most homeless people have some way to get an income, and a fairly significant percent, particularly outside of big cities, do have jobs. They just can't afford rent.
And if you want to get a job, how can you look like a viable candidate in interviews when you're living in a shelter or on the street?
We've seen people who try to stay clean, and it's hard to take a shower and get cleaned up to go to your job when you're sleeping in a tent, in an overpass. And for those, but it's also fair to say that many cannot get a job. Either they're not competitive due to mental illness or other problems in their lives where they didn't get enough education or job experience to make them competitive. And, in an economy that's become increasingly more technologized and more reliant on more education and more training, these individuals are the first to be left behind when it comes to looking for a job.
If the goal is to get people off the streets, get a job, and get off drugs and alcohol, Padgett says the surprising solution is to provide housing first. Don't require them to abstain from drugs first or have a job first. It's nearly impossible to do all of those things without a home. And those rules simply drive homelessness up.
People just thought, it's not going to work. You're not going to take a person who's actively using crack or drinking heavily, has a mental illness. It's not going to work. They can't live indoors. They can't. Well, it did work. And you can take people that had been ignored by every other homeless program and give them access to housing, and lo and behold, they adjust, and they do pretty well. That was kind of the revelation, I think, of Housing First, is that it went against every core tenet that we had in American society, that if you didn't have housing, you had to earn your way back into that situation. And it was a fairly gutsy move to say, no, you need a home first. It's never housing only. It's always housing plus, because individuals often do need help with money management or nutrition or cooking and doing things to adjust to living indoors.
However, Padgett says we lack the political will to take the billions we spend on shelters and jail cells and put it instead into subsidized housing for the poor. It's a culturally difficult adjustment to make.
We do have compassion. We're better at, for example, we have disability income for a person who has a diagnosed serious mental illness. So they make a certain amount a month. If you have a sight problem or if you're physically disabled, we do have programs for those individuals. But what we don't seem to do very well at, and what we seem to have lost compassion about, is just being poor without having a disability and just simply not able to pay the rent.
You can find out more about Dr. Deborah Padgett and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. This segment originally aired November 2019 and was written and produced by Reed Pence. Our lead producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.